Um, I'll ask one question, and then we'll go to questions. The first thing, again, to thank you. This is a tour de force and full of rich information. Our task is to look across domains of information and try to focus on salient questions or salient findings. So I just want to highlight one thing that you said, which is you thought that knowledge of child development should start with education in high school.
Yeah, my view is that not too long after high school, people become parents, right? And so here is what might be called a sensitive period, a point in the life cycle when education of a certain kind, all right, which has been shown not just in my work, I use that as an example, but in a variety of studies, which show that knowledge of child rearing and child development may actually facilitate or improve positive parenting. And so you have in high school, although many children don't finish high school, there is a period during which they are going to high school where the education about parenting and child development may be in society's interest.
Yeah.
I think that's what I'm trying to say.
And I think the idea there is to start early, not wait until people are parents. So let me just go then to my question, which is that it appears that co-parenting effectively, mother and father together, is a particularly desirable outcome, and that you were very clear, and I think very helpful in showing that interventions or characteristics of interactions may lead to different positive outcomes, physical interaction, social interaction, and so on. Would you be willing to comment on the implications for intervention design of those two? Co-parenting and what might be done to enhance that, and then this notion that various kinds of interaction lead to specific outcomes.
Okay, so those are two different questions. You know, on the first question, namely about co-parenting, we know that certain segments of society are now suffering from single parenthood. All right, and I say suffering because I think that two parents are better than one, all right, particularly when the one is in the labor force more and more and struggling with childcare. So that if two parents are both of goodwill and informed, that would be a better context and situation for parenting than one parent who's working. All right, and so in general, I think that society's promotion of valuation of the two-parent family, however it's constructed, is a more positive future development. On the second issue, as I tried to underscore with the specificity principle, perhaps a challenge is finding some mechanisms like responsiveness and like knowledge of child development and child rearing, which rising above some threshold could have general positive effects. All right, I spoke to them specifically with respect to language, but there are also indications that certain kinds of responsiveness promote affectance, so a phenomenon called affectance in young children, namely the sense that I make a difference in the world, because when I do something, it has a result, usually a positive result, on the person that I'm interacting with. So it could be that, with respect to the first part of the talk, that one could identify some general principles that could be worked into parenting programs. But as I tried to speak out of the other side of my mouth in the second part of my talk, one can't expect that just being rich, as Sunya Luthar will point out, or just having a big house, or just having goodwill will automatically mean that children will be moral, that your children will be moral, will do well in school, will avoid drugs, will be civic-minded, and so on. I don't think that there's, I don't think that there is a single, if you will, and allow me to repeat myself, magic bullet with respect to parenting. And it's possible that the old saw that children don't come with an operating manual is the case, because that operating manual is the child's lifetime.
Yeah. Well, thank you. So, members of the committee, yes, Barbara. Maybe you should identify yourself when you ask your question.
Yeah, I'm Barbara. If you could go to the mics at the mics.
We are recording this session. That's why we're asking people to go to the mics.
They're tall mics, too. I'm Barbara Rogoff, University of California, Santa Cruz. That was a great talk, and I thank you for that. I wonder if you can tell us, you described a lot of research that's based on correlations between what parents do and how kids turn out. I'm wondering if you can isolate studies that actually give us confidence about causality rather than being based on correlations either of the simple kind or of fancy kinds. Is there much in the way of research with human kids that would help us figure out the causality question?
Yes, I can do that, but I would never presume to do that extemporaneously. All right, my experience is that when people try to draw on some large literature or some emerging literature, they're more likely than not, and I'll count myself among them, even though this is being recorded, to make such facile errors. However, as I tried to point out in the example of the time term, okay, in the specificity principle, there is an emerging literature which adheres to a more conservative design of predicting performance at time 2, later in children's life, over and above what the child is bringing to the situation, all right, from either early experience or later experience. So I think that the literature is developing, the longitudinal literature is developing in such a way that there are more of those more credible, predictive kinds of things, kinds of studies. Now, whether they're causal or not, all right, how shall I say this without trapping myself? Many fewer experiments exist in developmental science, all right? It's hard to manipulate children that way and get that by institutional review boards, all right? However, there are some out there. There was a very nice one that I'll recall that Jay Belsky did, in which he looked at the base rates of children's play and divided them randomly into 2 groups, and then trained mothers in one of the groups to play in a certain way, and then tracked the children's behavior over time. And the children of the mothers who were trained in a certain way, the mothers changed their behavior, and the children's play increased in its sophistication. So that's the kind of study that one could hang one's causal coat on with more firmness, all right? But doing those studies are, I think, fewer and far between than we would like, all right? Right now, you know, the statistical ways of doing things in longitudinal cascade analyses or more primitive regression analyses, such as I showed between 13 and 20 months about responsiveness, are trying to get at that, but you know, there are always third variables possible and so on and so forth. So getting at causality is not all that easy to do, shall we say. And I think that in any science, that's it is not special to developmental science.
Thanks. Next question.
Good morning. Thanks for your talk. I'm Rick Barth from the University of Maryland School of Social Work. So the idea of teaching high school students, who are a relatively captive audience, about parenting is a good one. But we also know from lots of parenting trials that practice makes permanent, and if you don't use the skills relatively frequently or get coaching about them soon after you've received the intervention, there's a lot of decay. Do we actually have any evidence that you know of that teaching high school students who will someday be parents, or maybe they have nieces and nephews that they helped parent, is actually an effective intervention?
I don't personally, but there is a continuing proliferation of parenting programs out there, and I don't know them all. Someone else in this audience may. I threw that out as a a friendly recommendation, okay? It's an idea that I've had myself, and I think that this would be the appropriate audience in which to share it. So I don't know that. It is true, and I think you're correct, that if we ask one of the experts in intervention, like Doug Powell, about the fidelity of interventions and about the decay over time, he would, and I'm speaking for him now, but allow me to, he would be dismayed at how a wide range of programs don't institute the appropriate fidelity measures and don't track how decay occurs over time. So I think that's something that's to be done. Now, there are other people, and I think that Ken Dodge will later speak to the issue of parenting interventions much better than me.
Thanks.
Next question, please.
Okay, I am. Okay. Okay, I am. I'm Michael Wald, a committee member, and have a question that sort of is like Barbara's, but in a different way. At the beginning of your talk, when you talked about verbal responsiveness and stability of verbal responsiveness and big differences, I was following you. And it seemed important for a committee that is trying to make recommendations. In part, what would we be teaching high school students? What would be the curriculum? It can't be all over the place. Once you started to move to small effect sizes in complicated ways with different children affecting cognition versus play differently in different ways, it was much harder for me to see how that translates into public policy in any way, and particularly then when without, let's take the example you gave of the Bailey. So you've got one group, the high group at a 95, the lowest group at an 85, and the middle group at a 90. And forgetting the instability on the Bailey, I don't know where a cut point makes a difference in the long-term outcomes. Is a Bailey score going to make a difference in whether I'm likely to attend college, whether I'm likely to drop out of high school? So what I wonder in a broad sort of way is how much you can narrow into, you said you were going to give sort of 8, but then it became highly expanded. Can you really narrow down to some very core things that we think theoretically or by empirical things with some degree of cut points we could translate into programs?
So the programs would be with respect to parenting,
yes,
right? With the hope that the change in parenting would affect child development.
Right.
Okay.
Specific aspects of child development.
As opposed to intervening with children directly.
Exactly.
Right?
That's
so
what we're about.
Already you're creating an indirect effect. All right. And what you hope is that the intervention with the parent is going to affect the child as opposed to the direct intervention with the child.
Right.
All right. And so how can you intervene with children, all right, to maximize child outcomes? Okay. So what I tried to show in my talk was that there may be some general mechanisms in how parenting is instantiated. Responsiveness, I was asked specifically to speak to responsiveness, and so I did, as a general mechanism that people have looked to and identified fairly consistently as being one which parents could, if they knew about on a broader scale, could take advantage of, all right? They may or may not know to do that. As I pointed out, even in middle-class families, there's a wide variety of individual differences in parents, and some are at the low end of their responsiveness spontaneously, and that is in their everyday behavior with their children, and their children are learning language at a less rapid rate, all right? And another one I pointed out as a general mechanism may be an aspect of parenting cognitions, and I pointed to 2, namely satisfaction and investment. The knowledge that you should be oriented in invested in your child, and your knowledge of parenting and child development. So for example, if you're the parent of a 1-year-old and think that all 1-year-olds should be able to reason logically, all right? Some people call their toddlers little men, okay? toddlers are not little men. All right? They don't have the cognitive capacities of men. They don't have the physical characteristics of men, and so on. And the attribution which some parents make to their children, which is developmentally inappropriate, then can lead to expectations. A little man shouldn't cry under certain circumstances. All right? When a 6-year-old is hit in the head with a hardball, as will happen every day for the whole spring to many children around the country, some coaches will say, that doesn't hurt, all right? Shake it off, all right? And other coaches will say, yes, it hurts, but the hurt is going to go away, all right? What kind of parent are you, all right? Are you going to deny to the child what the child is actually experiencing phenomenologically, or are you going to acknowledge that and have him learn from it, all right? So there are different individual differences in how parents respond to the events in their children's lives in different ways. I think
I'm going to be sure to let the next two questions come, and then I think we're going to have to move on. Unless there's a third burning question, Oscar or...
Yeah.
Okay.
Good morning, Ian Maruka, one of the committee members. My question is really about trying to really understand your point about knowledge, but really also that intersection with sort of culture. So for example, if you have a lot of knowledge, but then how you are reared or the context that you're in, how would you suggest we kind of unpack that a little bit more, but while also making it precise, if that was clear. So it's really trying to understand sort of that intersection of really what we think, whether it's cognition or attribution, how that really intersects with culture writ large, and just context in general.
Yeah, the context is going to, or ethnicity, whatever the context is, SES, ethnicity, is going to color the meaning of different kinds of behaviors. All right. So, for example, one that exists out there in the world is that Diana Baumrind identified authoritative parenting from a Berkeley sample of European American children as a critical kind of approach to promoting, I don't know, academic achievement in children, all right? And this kind of authoritative parenting, as opposed to permissive or authoritarian parenting, was taken as a general principle until some people said, wait, does that operate similarly in different ethnic groups? And it turns out that it doesn't, all right? So there is an illustration of the specificity that I was trying to reach for. It turns out that in some circumstances, authoritarian parenting is culturally interpreted, its meaning is culturally interpreted as watching out for the child, warning the child about certain dangerous situations, and that has a positive effect on children's, in this case adolescents, academic achievement. So the same mechanism did not operate in the same way in different cultural contexts. And so if one like this group is going to attempt to apply some general rule across the diversity of American culture, all right, one is likely to run into such exceptions and differences based on cultural interpretation, ethnic interpretation of behavioral meaning.
Thanks.
Okay, last question.
Thank you for your talk. I'm Eric Deering from the committee. You, during your section on co-parenting, I think I saw a bullet point, but so the question might be really quickly answered if I didn't see this correctly, but I think I saw a bullet point that said something to the effect that co-parenting may have indirect effects on children via, I read it as some kind of social capital mechanism where one parent is learning new parenting strategies from the other parent.
Right.
And I wondered if I read that correctly.
So you've got two people who came from two different families, all right,
Right.
where they may have learned their parenting skills. Now they're coming together, all right? Maybe they've had the discussion about how they're going to rear their child and come to an agreement beforehand, or maybe they haven't, all right?
So,
and so they are bringing different knowledge,
I get it. So,
practices.
So what I'm wondering is, are there data that we could turn to that support that, in fact, something positive is happening as a function, as opposed to, for example, regression to the mean or something worse? That is, so I'm wondering about, are there data that suggests that, in fact, that the couple moves towards the higher, more talented parent?
It would be nice if that were the rule of life. I'm not sure that that's all the time the rule of life, and I can't produce it now. But there is a developing literature about co-parenting, and I can go before the Senate committee, I can go, Senator, and my people will send your people, the appropriate data.
Right. One last quick question,
Yes,
then I have
sir.
one.
Thank you. I have a.
What? I'm sorry, Oscar.
Oscar.
We're challenged to describe the research related to diversity of families, and so I was wondering about how generalizable the findings of co-parenting are, for example, to lesbian and gay couples, to extended families. Does 3 parents do better than 2?
I'm going to give you the same answer as him. Either I'll produce that information for you or find out the Jamie McHale or the Sarah Shop-Sullivan who can provide that information for you.
I've been asked by my leader to end this section. I'm going to do that in a different way by saying we've been asking you lots of questions. Do you have any final comments or observations for us?
Good luck.
Okay.